today with Irene.
Hi.
And am I right, this is your first time at a chiropractor?
Yes.
Okay, and you're nervous? Totally fine, totally understandable. I'll get into all of what there is or isn't to be nervous about, but until then, why are we here today?
I have a problem with my neck.
Okay.
It kind of hurts, and the lower back.
Okay.
So I feel like you will definitely notice when you just try to fix it. So
let's talk about the first one, the neck, and then you touched right.
yes, and
Yeah.
it's on the right. I don't know
Okay.
why, but maybe I don't know. Something.
And this is a common thing too. The words that people use and then the words that are the actual, proper terms are different. A lot of times people say neck, but then they're pointing sometimes out to either the top of the middle of the neck or out, almost sometimes out in the shoulders. Where are you pointing to exactly?
Isn't it right here?
So when you watch where she points, and this is really important because I've had a lot of people come in, they say they have neck problems, and then their doctor did X-rays of their neck. The neck is technically 7 bones right here. It doesn't include this. So I've had a lot of people who've had injections or surgeries or a lot of tests done on their neck because they said they have neck pain. When they point to where it is, and when we actually look for problems at where they point, a lot of times you find it's not quite where it is. It might actually refer pain into other areas of the body, but it's really important if you're a practitioner or even if you're a patient, make sure that when you say stuff that they're actually looking at the right area. So right there. And that's kind of, maybe a little bit in the neck, maybe in the lower shoulder.
Yeah.
Okay. Anything on the other side?
No.
Okay.
It's
and then
mostly on the right.
And most on the right. And where was the other area you were talking about?
It's also on the right.
Yeah, down in the low back.
Yes,
okay. And what she's pointing at is kind of low back. Okay. So with those 2 complaints, I'm gonna be going over how we would start to find where the problem is, see if we can find a problem that's relevant. If we can, then we're gonna go over the treatment and see how maybe it is or isn't scary. I'm gonna guess it's not as scary as you think. Earlier, Irene was telling me that she has problems through here. When we actually look at the point where she's pushing, where she's pointing, remember, Irene has a very long neck, but the neck is actually from here up. The middle back technically starts from here and goes down. But where she was pointing is not quite either one of those things. It's a little off to the side here. This is a really common place for people to get problems here. When we look at this area, there's a few things you want to look at. One is it can be coming from the neck and coming out this way. That's not as common as you would think. Even though a lot of people will say it is, it's because that's just the first place where they look. Let's get ourselves focused here. Another place where this can come would be from the mid-back up quite high. A lot of times this area goes missed because it's a hard area for someone to work on, particularly chiropractic-wise. A lot of them will miss this area because it's really easy to work on the neck, it's really easy to work on the mid-back. This area, which is a common problem for people, it's a postural problem, and not a lot of people know how to correct that. That being said, for Irene in particular, when she says that it's only the right, it really makes me think that we're going to be looking more at something affecting the shoulder, which has a muscle that goes straight up that way, or something underneath the shoulder, which is the right part of the rib cage, or the traps. Because if she had any problems in the neck or in the thoracic spine, it would at least a little bit bleed onto the left, a lot more likely. So we're going to be taking a look through right here. The way we're going to check right now, I'm going to have you put your hand just right there and let your shoulders drop. There we go. And one of the things we want to come look for, it's a very common thing to find, is to find a problem with the thoracic cage or the rib cage in this area. And when we look here, it's not actually as bad as I would think. But you are tight right there. There we go.
Yes.
Okay. So it's not bad as we think until we get right exactly in the spot, and that's the exact spot right there, right? So when I pushed on anything else, nothing really bothered you, actually. I can kind of dig in, it's not too bad, but this particular spot right there, that's a lot. Yeah, let your arm drop. And that's really what you would hope is that if someone is doing an exam, let's go across your other arm, they should be able to find the exact pain that you're talking about or something pretty close to it. Sometimes if the pain's deep inside, you can't quite get to it, but for her, she might be feeling a little bit deeper where this joint attaches deep inside there, but when I get to the part that's accessible, she can definitely tell when we're right on the spot. It's very distinct. So that's a pretty good indicator. When someone tells me where their pain is and you check that area and you're able to recreate it pretty faithfully and get to the exact spot, it tells you that you're going to be able to potentially help this person. Your pain in your low back?
It's mostly this thing.
Yeah.
It's a little bit more on the hips too.
Okay. So this is another common thing, is for someone to have back pain more on one side. It's really common, just like I was talking about with the neck, for people to look at the neck. When someone says they have neck pain, just to look at the neck. It's really common when someone says they have low back pain for the doctor to look at the lumbar spine, which is these 5 vertebrae from here to here. And so they'll often do an x-ray or potentially an MRI or a CT. And they want to look, because there's discs there, there's potential for nerve irritation. It's a place where people can get injuries. But one very, very common thing that we find chiropractic-wise is that there are, below the lumbar spine, where your sacrum and your pelvis are these two joints right where my thumbs are. You can see oftentimes there'll be a dimple right there. When someone says they have pain mostly on the one side or only on one side, very, very common what you're going to find is that there's actually dysfunction with one of these joints. They're called the sacroiliac joints. And when that's the case, what happens is these joints will also disrupt the lumbar spine because they affect how the motion of all the motion that's when you walk, these joints are supposed to wiggle. And if these joints are having dysfunction, then those forces, instead of being absorbed by this joint, those forces get absorbed by the lumbar spine. So a lot of people will have lumbar problems, low back problems, but it's secondary to having a problem down here. These will not show up in X-ray, these will not show up in MRI unless someone's doing a very particular type of looking into it, which is not very common. And one way that we can easily see if this is the case is I'm going to put my fingers right on these joints so that I can feel the motion there. Now first of all, right when I put my fingers on the joint, I can feel there's a different prominence on this side here. And you might be able to feel if I can get right into the spot that it's got just a small bit of like a light bruisey quality in there. Mm-hmm. Yeah. This side I can push in all day, feels like nothing, it doesn't bother her. It's just like if you squeeze your finger, it doesn't hurt. But if you jammed your finger, it would have a little bit of a kind of a bruisey quality. She's definitely got that, and you can even see if you're looking really close how this one is no big deal, doesn't do anything. When I touch on this one, first of all, you can see it's just hyper-inflammatory because it leaves a little bit of redness and it leaves a little bit of like a swelling. You can see my fingerprint when I push in after that. So that joint, very, very likely problematic, and is very consistent with the symptoms she's telling me. So I'm guessing that this is our bad guy. We're going to take a look at the motion and see how that's working as well. So from right here, I want you to lean to your right side. That's it. And when she leans to her right, what should happen is these joints should shift, and the pelvis should stay on the table, but these joints should shift, so I should feel motion underneath my thumbs. And that's what happened there. Now lean to your left. And when we go to the left though,
oh my God.
First of all, you can feel that because it's forcing this joint to have to work. And you might notice, go back to neutral. You might notice that when you go to your right, that my fingers stay relatively level. In relation, I don't know if you can tell on the camera, but in relation to the floor, that's level. When you go to your left, this one lifts. This one on the right, the joint doesn't move, it's being pulled up with it. Come back to neutral. And sometimes the easiest way to see this is let's have you lean straight forward. And actually, it's kind of off on both sides on this one. You probably can't see it on camera. Let's come back up. So the pelvis has got some misalignment issues on it. It's very common. Most people have, at one stage in their life have had a fall in the butt, fall on the knee. Maybe if you're driving and you had a little bit of a hard impact. Sometimes the forces through the gas pedal. You have anything like that?
Yeah.
All those? So it's very common. It's just it's part of the way humans are built because this is such an important structure for the stability of our body in the upright position. It's very common for it to dysfunction, and our bodies are good at just sort of managing it. They'll just deal. So the body will often compensate by throwing the weight off to the other side and just walking around with this injury for a long time. But it's enough where she can feel it. So we're going to be addressing that right now. I explained to Irene the adjustment we're going to do. I checked her in the sitting position. I'm going to recheck with her in the prone position, with her laying down. A couple of reasons. One, I want to make sure that it feels consistent because some things are compensatory or they're only positional. So if we check her in laying down position and things are different, then I have to see if there's something else going on. But if it's consistent, which it is, I can feel that right there. It still feels the same. Then I know that this is a consistent problem with her moving around in different positions and having moved around the room. The other thing that's important is you'll notice that anytime I do an adjustment, I spend a long time making sure I'm exactly in the right spot. I see a lot of some types of practitioners going through crunch, 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 crunch. When you do that, a lot of these, especially on someone like, were you a dancer?
Yes.
Okay. Especially on someone with someone who's flexible, someone who might have hypermobility. If you go through and just crunch a bunch of stuff on her, and I just crunch, 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 she might walk out if you're feeling better, she might not. The chances of me getting this problem corrected are very low. You might get everything else around it, and this area that's stuck is going to be the least likely to release. And so that's why a lot of times people go to chiropractors or other similar type of practitioners, they get everything cracked, they feel good maybe when they leave, and it's very short lasting. It's because we need to find we need to spend the time to make sure we're exactly in the right spot and get the exact right correction. I would rather get this only and nothing else, and that's going to help her a lot more than if we were to crunch all the way up to the top and all the way to the bottom. That's just a big mess, and it might or might not do her any good long term. I don't think it would be very beneficial. So when I do the adjustment, I'm going to be focused everything on exactly on this right spot right here. The way I'm going to do that is that part of my hand there. And you can help me out. You can give me a breath in. When you let the breath all the way out, let the right shoulders drop down to the ground. And we're right there in. You're right there. Give me a second. Push that forward. A second ago, when I was doing this adjustment, I was talking about how important it is to be exactly in the right spot. When we're coming down here, remember we found Irene's problem right in this joint right here. This is really important that we do this correctly because she's tall, skinny, and flexible. This is true of everyone, but particularly in something like this. If I were just to do a sloppy adjustment, put my hand anywhere and twist her, it's very easy to get things to cavitate or release and have things crack all the way up. The chances of this one releasing and releasing the proper way are really low. It's already stuck. It's a problematic joint, but these other ones are probably hypermobile because of that. So in case of hypermobility, or any case really, you don't want to get any adjustments on spots that don't need it. So what we want to do is we want to make sure we get a very clean, very targeted adjustment on this joint right here. The way I'm going to do that is I'm going to have her just leg straight and tuck in a little bit. And we're not really doing a twisting motion of the body. We do have to just do enough of a stretch to get her body to slack. I'm going to get her in this position. You're going to breathe in. And when she breathes out, I'm going to bring her in towards me, lean up on that shoulder. Just do that right there. And she'll tell you that that was exactly underneath my hand. We didn't have cracking going all the way up. We're going to recheck that and see how that looks. So you just see the face. How you doing? You just see the face. That's still going to be tender, but we want to check the motion here. So again, I want you to lean to your right side, and then to your left. Back to neutral, that's great. And then forward. That's great. Watch, come back up, go to your left again. I don't know if the camera will catch this. That is dead on. Let me come back to neutral. So I don't know if the camera picks that up, but when she was going to her, leaning to her left before, this joint was trapping up. It wasn't staying level with the other side. But now when she goes to her left, it moves really free. It just stays. And that's exactly what we wanted. We didn't get any cavitation anywhere else, just in that spot there. There's still some swelling that will subside as the day goes on, and I would expect her to get a big degree of freedom where she didn't realize it was lacking, and also along with that, a big decrease in her pain. So that's how you do that.